Matters podcast. This is your host, Addis JB3. And I realized that even after maybe three and a half years of recording the Equity Matters podcast, I have never taken the time to talk about who I am, where I come from, and why I do this work. And so think of this episode as a get to know me in a sense. Part of the reason why Equity Matters exists is because I realize that I have a responsibility. And part of that responsibility is tied to my privilege. My privilege is the fact that I have advanced education. I have access to some of the smartest people in public health and in social work. And I wanted to create a vehicle that could share that information with others. During the height of the COVID-19 pandemic, realizing that people were experiencing abundant misinformation, disinformation, I knew I had a responsibility to disrupt some of the myths and also talk about the importance of equity and equity endeavors across a variety of spaces. Now, we've evolved a bit since then. I don't necessarily have guests on quite frequently, and I really wanted to highlight kind of my perspective on things. And so as we talk about what it means for me to be a social worker, to be a public health advocate, to be a bureaucrat even in these spaces that I have to navigate these various systems, equity is still the through line in all that I do. And part of that is because I know that individuals don't always have a fair opportunity to engage and to participate. When I look back on why I've taken the path that I have, part of it is very clear. Growing up on the west side of Detroit in a 2-bedroom, 1-bath home with a father who had substance use issues and a mother who experienced interpersonal, intimate partner violence, all of those things I think have shaped my perception of the world around me. And the home that I grew up in, my mom likes to use this phrase that it was a house, it wasn't a home, but it was my home. And it showed me some places where there were missteps, things that shouldn't have happened, things that a child should never be exposed to, but also what it means to try, right? To try to do what you can with what you have. And part of that is, to me, the spirit of Detroit. It's what we do. It's we go out, we make things happen, we hustle, we grind, we put the buffs on, we make it work. And I don't shy away from any of that. I think part of that is just through participating in therapy and being able to talk through those things. But there's clearly values and context that have become more clear to me as I've gotten older. And so in the spaces that I occupy in public health, when I talk about disparities and I talk about inequities, it's not coming from this high and mighty place of, oh, you're Dr. Bell. This is what you do. This is your research. No, this is what I've lived. This is what I've experienced. This is what I've encountered. Even within the last 2 years, I lost a cousin due to fentanyl. And I've never got engaged in opioid use disorder work, but now I see what it's like firsthand, that lived experience of receiving the phone call that your cousin has passed away because of something that should have never happened in the first place. And it drives me to dig deeper, to ask the question, why? Why is it that certain populations are disproportionately impacted by a problem? It's because I've seen these things firsthand. It's also where I really start to think about why would education be so important to me? When I look back on the schools that I grew up going to, many of them are closed now. So my elementary school no longer exists. My middle school merged with a different school. My high school is still, to me, the best in the city. And there are just so many touch points along the way of like this timeline that I have where education had to be prioritized. And it wasn't until I became an adult that I realized that education has always been a value in my family, whether I knew it or not. As I dig into ancestry and get to know relatives, I was elated to find out that I was not the first doctor in my family. I'm more recently doctored, but there are others who paved the way for me, who made sacrifices for me to make these things feasible. And so if you go way, way, way back, one of my great, count the G's, grandmothers was actually one of the first teachers at a school in Georgia for enslaved black people. I don't take those things lightly. And so to fast forward to 2023, when I'm a full-blown professor, like I am teaching at a college, at a university, those types of things, they are in my DNA now. That is what makes me who I am. So the same way that I perceive disparities and inequities is the same way that I look at education. Like all of these things have come together to shape who I am and why I do this work. I don't know why I was called to do diversity, equity, and inclusion work. I actually talk to people all the time that I'm not a DEI practitioner. I'm not a DEI consultant. And I keep getting opportunities to do DEI work. I personally want to remove barriers for people to have good health. I want to make sure that people can navigate the various systems that they occupy in a way that is safe, that a way that is empowering, where they walk out at the end feeling like they can thrive. I tend to think of DEI as a human resource function. It's for personnel, and that's only because of the way it's been shaped for me. I want to talk about anti-blackness. I want to talk about the fact that black people don't get a fair shake at anything. And I know this will get me comments somewhere. Someone's going to see this or see a snippet of this and say, oh, what about everyone else? Yes, everyone deserves a fair opportunity. What I'm saying is black people never get the fair opportunity. That's neither here nor there. But again, back to why I tell these stories. Why Equity Matters exists. It's because I've learned that we have to tell these stories. We describe systems change. We talk about how we want things to change within the system. People tend to jump toward advocacy as the only method for doing that. And advocacy takes many shapes. Part of it is telling the story, being able to describe how things are different now because we were able to create some intervention. I'm going to spend a little bit of time thinking out loud here, so bear with me. Those are the worst podcasters, so let me be them right now. How my story shaped who I am today. I often think about growing up as someone who wasn't necessarily the popular kid. I've never been the popular kid, and that's okay. What stands out to me is during high school, during those formative years of my life, was one of the first times that I ever felt suicidal. And so I want to be mindful of the content of this episode. And my mental health took a drastic turn. I was sick for about half of a school year, where I missed maybe 2 months worth of school because I had a nervous breakdown. And I've never talked about this, at least not in a public forum, but now being almost 17 years removed from that experience, I can look back and those feelings that haunt me, that kept me in that place, I think in many ways drive why I do suicide prevention work now. I've never talked about being a survivor or a person with lived experience, but it's very much true. It's very much in my DNA who I am. I don't know how God aligned me to do this work, but I have to be in those places. And so shout out to Brandon Johnson from SAMHSA, who I've had on the podcast before. If you go back to one of our first community of practice episodes where we talked about equity and suicide prevention, and we've kept in contact. He's invited me to come speak as a subject matter expert at his Black Youth and Suicide Policy Academy. And I never thought that, one, I would live to be able to do this type of work, but now I feel like I'm almost assigned this type of work. And so when we talk about the importance of diversity, equity, inclusion, and we talk about the importance of equity, so much of it for me goes back to, well, how did I get here? Where in this roadmap of social work did I say, oh, I want to do suicide prevention? It was never on the path. I wanted to be a clinical psychologist. I wanted to sit and document people's concerns, give them solutions, and send them about their way. When I arrived to Michigan State in 2006, that wasn't the plan for me, clearly. When I wanted to venture out, I tried the pre-med thing, and organic chemistry humbled me in ways that I dare not repeat. I was exposed to social work through an internship at a community-based organization that took the time for me in a summer to say, you know what? I want to understand why people have different experiences, why people are not able to thrive in the way that they feel best. And I want to co-create solutions with them that will address their concerns. That experience changed my life. That experience opened me up to thinking about community-based participatory research. That opportunity got me thinking about what policy change looked like and what advocacy looked like on a local level. How community groups were able to come together and create their own plans. And as an institution, we served as the backbone, providing the infrastructure and the resources and the staff time, because those things were not available to the community. And then we were the convener because we were able to bring local politics to this type of conversation. After leaving that organization, I was able to immediately apply to grad school because I knew that I needed something, because a bachelor's in psychology was insufficient for me at that time. And a master's of social work made all those things feasible. Like many others, I interned at a location that I think it was more so check the box. And so I was able to intern at the courts in our county. It exposed me to the juvenile court system. It exposed me to child welfare. It exposed me to human services. But it also exposed me to the gaps in all of those things. After leaving the courts, I was able to then go to our community mental health agency. It showed me again that there's gaps for people who are already marginalized in many ways. What can I do about that? The day I graduated, I received a phone call that I had a job offer with the Department of Human Services as a child welfare investigator. And it wasn't the job that I wanted, but it was the job that I needed. It was the job that I needed because it would then reinforce all of the things that I've seen in my life up to that point, where we talk about broken homes, where we talk about abuse, we talk about neglect. And it just became very clear that the gaps that people were falling through the cracks on were not created by them. It was created by systems, it was created by institutions, and I couldn't purposely live in my truth knowing that I was contributing to said system. I like to tell this story, I may have told it on the pod in the past, I'm not sure, about how I received a case where it was a mother who she called looking for assistance, she called looking for help, and in response they sent me. And I, as a child welfare investigator, was not in a place to provide assistance. My job was to protect said child, and typically policy would dictate that I needed to remove that child. That is the moment that I knew I couldn't do that kind of work, and I wanted to do the type of work where I could be restorative. And so I wanted to get to a policy place. I wanted to get to a place where when I was staying up late at night asking how could this be the case, I wanted to be the way that we said, no, we're not going to do things this way. We want to make sure that children stay in their homes with their family. The data clearly says that children thrive better when they're with a familial partner. So I wanted to make sure that I could be in a policy space like that. I've been fortunate in many ways to be led by some of the best Black women in public health that you can think of. So I've worked under the leadership of Dr. Renee Kennedy, who I don't shy away from, has been extremely supportive of me, helping me to navigate through this public health system and really exposing me to what health equity was. I didn't have the terminology at the time, but she was able to help me to orient myself on health equity practice, on health equity principles, what it means to be intentional in your work. And I take all of that with me. And fast forward to 2019, I left and returned to state government. And I returned to state government because there was a new chief deputy for health. Her name was Jonay Caldoon. She was the health officer for the city of Detroit. She was just really impressive, and I wanted to learn from her. I wanted to learn how to lead public health from someone who looked like me, who was from where I was from, who understood the context and the nuance of what it meant to be a Detroiter. And coming back to state government to work under her, the timing couldn't have been better, because 2019, probably the second or third week on the job, I was exposed to our first environmental threat, which at that time was Eastern equine encephalitis, EEE, if you're not familiar, where mosquitoes needed to be sprayed in batches. And so that was my first exposure to like true public health crisis response. You fast forward a few months, we get to February 2020, where we're tracking this virus from Wuhan, China. And you get to March 2020, and we're now at the very early onset of the COVID-19 pandemic. And you start to hear the discourse change as people talk about the impacts of disparity and inequity and power, and how instances of racism and oppression have now shown up, though it was always there, in the medical system, in the public health system. Why won't Black people get vaccinated? What is vaccine hesitancy? All of these things that I had been prepared for as I talked to my grandmother, and I talked to people who are in my family saying, I don't know if I'm going to get that shot. And I compare it in many ways to having insurance. And you can't drive a car off the lot in the state of Michigan without proof of insurance. And you can surely get a one-day policy, but if something were to happen to you, you want to have your policy. And so being able to articulate that to people who look like me was really important. I had the wonderful opportunity to lead our Protect Michigan Commission, even for a short period of time, where we had those commercials where we were talking about the importance of being vaccinated. All of these things, health communications, health policy, all of it has followed me throughout my career and throughout my life. To be able to articulate, to bring the data, to bring the personal stories, to bring the importance of this work, leading our department's child-led prevention strategy in the aftermath of the Flint water crisis. I was terrified. I'm still terrified. But I realized the importance that now that I've had time to look at the data, to look at, well, why are children in this particular area being impacted? Well, if we go back, we can see that, redlining was an issue, even in Michigan, where certain communities were pushed into very specific geographic regions and zones where old houses exist, where there was paint that included lead, and Black children live there today. Well, why do Black children have higher rates of asthma? And you start to see similar things. You can map those things on top of each other. And for me as a public health practitioner, I'm almost public health disease or condition agnostic. For me, it's about equity. It's about how do we make sure that all of these children have an opportunity to have good health. And so whether I'm sitting on a panel for sickle cell, whether I'm sitting on a panel for suicide prevention, that is what I'm thinking about. Because I'm thinking about little James who may not have had the same type of opportunities had I not had a praying grandmother, had I not had people who cared about me, who positioned me, or my kindergarten teacher who told my mother that you have to get James out of this school if you want him to be successful. And so, Miss Tally, I don't know where you are these days. I hope you're alive and well. But my mom listened, and she got me out of there. And because I was able to have these opportunities, so much of my work is about creating the future opportunities for the next generation. I think about it with my own children. I think about it with other children. How can I be a vessel to make sure that others have the same type of opportunities that I do, and that the barriers that I encounter, they don't? All of these things are tremendously important to me, and as a leader in racial equity and health equity, all of these things are important. So why do I share this? Why do I bring this up? Understanding who I am provides contextual awareness. I know what is going on around me. I know the historical injustices. I know the current injustices because I've seen them. I am the product of them. I can interpret root causes. I don't approach problem solving from a lens where I'm only trying to address the symptom. We have to go upstream. And that's the type of work and the type of ethic that I bring to my projects. Even with Equity Matters, I don't want to talk about the surface. I don't want to talk about what we all can see. Let's dig a little bit deeper. Let's peel back the layers for the purposes of investigation, of curiosity. How did we get here and why are we still here? I think it also helps me to establish my credibility. I know exactly who I am. I try to tell my truth, and I think because I've been vulnerable enough to put my truth on display, it's received in a way where people say, you know what, he knows what he's talking about. He is willing to put those things out, to be transparent. I'm willing to serve on a panel and acknowledge that sometimes government is not the best solution. Sometimes we have fallen short. Sometimes we have not done what we said we would do. I've been on panels where I've had to apologize for things that happened before I was born. Well enough before I was at the department, but before I even started thinking about government. I am willing to be that person because that is what the future of this work is all about. To acknowledge that we have made mistakes. We have created systems that have socially disadvantaged others, but we don't have to stay there. And the last thing, I think it really just makes me more authentic. I don't code switch. I don't believe in being anyone different than who I am right here, right now. Now, I will be the first to admit that I compartmentalize often. And sometimes, and one thing that I've mentioned on the pod before, is that there's different pieces of me that I've had in different phases. So there's the academic James, there's the public health practitioner James, there's the faith deep James, there's all of these different pieces. And one day I realized that it was just too much. And so I wanted to be one me. And I wanted to be that authentic me where I felt like I was myself in all the spaces that I took up. So when I think about kind of the future of this work, the future of the Equity Matters podcast, so much of it is there's still more stories to tell. We think about systems change, we think about telling stories. I've got more work to do. And so this is the first episode of hopefully many. I got a few lined up in mind, a few different ways that I want to approach the podcast going forward. But just know that when we interact, whether it's on a panel together, whether it's you've invited me to speak, know that this is the person that you're going to get in those spaces. I might be a little cynical, I might be a little sarcastic. My humor is extremely dry, but those who know me love it. I want to just reintroduce myself to you all as James Bell III, Addis JB3, the host of Equity Matters podcast, which is one of my proudest creations because it started off as an idea, as something that I was just frustrated and I wanted to have my voice be heard. And now my voice is heard across the nation. It's heard in different countries. And so I thank you for tuning in. I thank you for listening, and continue to subscribe. Share this episode with somebody who needs to get to know themselves a little bit better. And just get ready because we got so much more to do. So as always, thanks for tuning in, and you already know, Equity Matters.